Well, good afternoon, you guys. Welcome to Elements Health Club in West Eugene. And we're at the Therapeutic Associates West Eugene Physical Therapy Clinic, which is connected right next door. I had no idea, because I go to the Springfield location, that we actually had physical therapy, and we can get kind of some deals with that as being a member of the Elements Fitness Health Club family. So I got to put my mask on so I can introduce you to this man. Brad, tell him who you are.
Hi, yeah, my name's Brad Schwen, and I'm the director of West Eugene Physical Therapy here on the west side of town.
How long have you guys been here?
We started in 1996. I started a clinic here at what formerly used to be Court Sports, now is Element Fitness. So we're into our 24th year, believe it or not, here at the club.
So what is the advantage of having you right next door connected to a gym like this?
Yeah, I mean, I think there's several advantages. First and foremost is just we have definitely an expanded opportunity to work with patients, particularly in a strength and conditioning and what I would call kind of functional performance aspect as they're, getting back from whatever injury that is. We have, as you'll see here in a little bit, I mean, we have a huge facility, not only our physical therapy space, but aquatics, strength and conditioning spaces, and also just some other functional retraining spaces that we have.
So if I come in here, and you said you're going to look at my wrist, Brad's going to look at my wrist here today too, because I'm having some things I'd like to get looked at. But then you can take me out into my gym and show me some things I can do right here in my own world. That's not me buying equipment or going out and doing something else. It's just, here you go, Rick. Here's something you can do on an everyday basis that could be different for me.
Exactly, yeah. With you being already a gym member, we can tailor something specifically for, in this case, your left wrist. That can be some specific exercises or some flexibility work, whatever the case is. And then you can just take that right into your own gym space, and instead of trying to explain things or give people pictures and take it off to some unknown location, we can really tailor it and have them practice and feel what it should feel like.
So in terms of what is the deal that people get if you are a member here? What kind of deal do they get through physical therapy through your clinic?
Yeah, I think it's really kind of three-pronged. If you come as a patient to our facility and you're not already a member of Element Fitness, the club has been gracious enough to partner with us to allow us to, again, utilize their whole entire space kind of as our physical therapy clinic. So we utilize that for all different types of programs in our rehab. If you are already a member and you have a what I like to say, bumps and bruises, just, a strain, sprain, something you're just wondering about, and you'd like us to take a look at it, we offer complimentary injury screens to all club members. It's about a 15 to 20 minute screen that we'll do, and we can offer you recommendations. And then probably the third thing that we can offer our patients is at the point of discharge, when we've really met your goals, your rehab goals, and you're ready for that next step, the club does offer a 10% discount for all of our patients if they choose to join. They'll offer them a discounted rate to then carry on in the health club setting independently.
So show me some. Maybe we just go through the front door. Show me how kind of some of the things that you guys use in here.
Sure.
And you guys, so just so you know, starting today, masks are required all the time when you're in the gym. And the other thing that happens when you walk in is you get your temperature taken. Go ahead. You betcha. Go ahead. Do my thing. Am I good? I'm legal? Okay. So everybody gets their temperature taken when you come in. You got to wear a mask like this young man right here. And
so this is probably our first space that we use actually quite a bit. This is the Aquatic Center. So we have both a 78-degree lap lane pool, and then the main pool is 86 degrees, so we can go all the way from 3.5 feet. For somebody, we want to do a shallow program, maybe some gait training, some lower body work, all the way to a deep end where we do a lot of deep water programming as well. and a lift down available for people that might not be able to ambulate comfortably up and down stairs.
So Brad, do you see, like with COVID and people staying home, and I'm going to get this direction on you so I don't have that backlight, with people staying home and not working out for a while, you could be pretty prone to an injury.
Yeah, if you were used to that and then your gym is taken away, it certainly is going to affect your conditioning, your flexibility, just your overall strength. And so people are going to be more prone to overuse type injuries or strains and sprains during that time. So it's just also a promotion that we're doing with Element right now, is we're getting the word out to not only we're here on the west side of town, but we have the location down in the Oakway area and also in the Gateway area. So we're getting the word out to all the members that even if they're members at one of those other locations, or that's kind of their home gym, I think you said you typically go to Springfield, is any of those members can come over to our clinic here on the west side and get that complimentary screen.
Show me some other stuff. I haven't been in this gym for a while. Sure. You guys, they redid this, and and then I'm going to go get my screen done with Brad on my wrist. So, amen.
Yeah, we'll just take you down. There's a whole other upstairs portion of the gym where pretty much all the cardiovascular equipment lives, and that's also the cardio studio. And then they have a kind of a functional training space up there where they have some mats. We have balance boards.
And you guys, we have racquetball too.
Yeah. They do have 3 racquetball courts. And then this is really more, they've redone this here recently too. So this is going to be most of your circuit training equipment.
Hey, Brad, Brad doesn't work at the gym, but can a person come and just swim?
Person come and just swim.
Oh,
yes, you can become you as
have
a
to
gym
be
member, you can choose to just use the.
Yeah, Laura, you do have to have a membership, but they have so many deals right now. I mean, I know at our gym, so I'm sure it's the same over here. So you should check with them and see. I swim 4 days a week, so yeah.
And this was the former men's locker room.
I was going to say
years ago.
I think this used to be where I showered.
So they've redone this, and this is all of kind of our free trainings. Free weight training spaces.
So your people you're working with would probably spend some time in here on those mats, doing some stuff with you.
Yes, we utilize this area for, again, this is a great spot for retraining things for, say, like lifting tasks. If we want to do any work with spinal exercises, we have physio balls over in the corner. There's some foam rollers around here. In different locations, we have kind of steps behind you back there. So lots of different options. And then again, we won't maybe spend the time to go upstairs, but upstairs again is kind of more that cardio training space.
So how important is it for people to, obviously, the more you stay in shape, the better you're going to be off, maybe not seeing you as much as other people might, you know what I mean? Not that I don't want to see you, Brad.
So ask me that question again.
So if people, the more you're working out and doing things, I guess for me, I need more physical therapy, but it also prevents injuries too, right?
Oh, certainly, yeah. There's a lot of research out there that shows, surprisingly, even as little as 1 day a week of cardiovascular exercise can reduce injury risk, just that in and of itself. And that's of course kind of a bare minimum, but
and you guys, this is the actual clinic where they work on you. And so Brad's going to
4 enclosed treatment spaces here. We kind of have a couple gym plinths out here that we'll work with patients out here now, and then kind of a smaller training space in here in our own physical therapy gym, because again we have such a large capability to do things in the gym next door.
All right, so let's go in here, you guys. So I, as you guys all know, I broke my wrist, and get that mask up there. Somebody will tell on me. So Brad is so as part of my membership, which I did not know until recently, with Springfield Elements, or any of the Elements gyms, I get a free assessment then.
Right.
He's going to look at it. Here's so you kind of see, there, I swam this morning, that's my wrist. And I hope you guys can hear that. I know it's hard with the mask, but go ahead, Brad. So show me what you would do.
Well, so I always like to ask first off, before we even touch a patient, is if you don't mind me asking you a few questions, just tell me how you injured your wrist.
Mountain biking. But it wasn't really mountain biking. It was when I was done with mountain biking, and I'm on the road, and my wife's tire accidentally hit mine. I went down. My hand went as a kickstand, and didn't work.
And what was your injury?
It broke the bone. This bone right here snapped.
Okay, so it looks like in your distal radius. Okay, and then looks like you've had some surgery. So tell me, when did you injure yourself? When was the surgery?
I think it was the 8th of May.
8th of May?
Yeah, and then the surgery was 4 days later. So it's been like 9 weeks.
Okay, and
something like that.
Have you been immobilized in a cast for a
I
period
was
of
for
time?
a couple weeks and then had a brace on it, but yeah.
Okay, so you've been out of your brace for approximately how long?
Probably
like a month?
Yes.
Do we want to say that on air?
Oh, probably 6 weeks, something like that. Chad is saying hi, Brad.
Okay.
We have a mutual friend, Chad.
Hey, Chad. I know Chad.
I'm going on a bike ride with Chad.
From Triangle Lake, right?
Yeah. Well, now he's out in Junction City, but yeah, we're going on a bike ride.
Buddy of my son's.
Oh, is it?
Basketball days.
He's a good guy. He's a good kid.
Okay. So then I just also would like to know, like, okay, you're out of your immobilization. You're trying to get back into activity now. What would you say are your maybe top 2 or 3 primary limitations, or what are the things you're having the most problems with still?
Like I can make a fist, but it feels really tight in here.
Okay.
Really super tight, and I can't do push-ups.
Because of the positioning, or it feels like it's too painful, or you just can't get in that position?
Yeah, it's like, and then sometimes
or a little bit of both.
Yeah, a little bit of both, and then sometimes when I push it, it starts shaking. You know what I mean? Because I'm building it up, but I mean I got a lot of atrophy for after 9 weeks of not doing anything.
So a couple things I would just do just to get a sense for what amount of restriction you do have. This is just a tool we use in therapy called the Goniometer, where we can just briefly measure range of motion. And I got to get my eyeballs on here. But let's start with your right side. I'm assuming that's been uninjured.
So here, you guys, I'm going to get it.
So we're just going to go kind of elbow by your side, and I want you to just extend your wrist out that way as far as you can. Let's just see what you got as kind of your normal. Okay, so you're about 85, and then how about this way?
That's so cool.
And so we're about 75, okay? Let's take a look at this one. So you had 85 this way, 75 this way. Go ahead and extend that one, keeping your elbow by your side. So we're at 64, so we're lacking about 20 degrees of motion that way.
I can feel that.
Okay, and let's try this way. Keeping that elbow by your side again. We have about 75 on the other side, and this side's 47. So we're a little even more restricted that way. So you have about overall just flexion extension right now, about 50 degrees of total loss of motion.
Wow.
And then another one, we can just kind of take a look at this, both sides together. Let's go ahead and take your wrists out this way. Oh, there we go. And since it was your radius, a lot of times people can move this direction a touch better because they're moving kind of away from that was 35. And that is 45, which is about normal, so about 10 degrees there. And the last one, which can sometimes be a little tough, is moving towards that fracture side.
Yeah, that hurts.
Okay,
or doesn't hurt, but
that hurts. So you're at 15 and 20. So not as much. And then the other thing I might just like to look at real quick is you mentioned you were having a tough time closing. So let's see what this is a grip strength. So I'm going to have you just hold that elbow kind of by your side and just give that as tight a squeeze as you can. Let it go. And are you right hand dominant?
Uh-huh.
So you're right at 96 pounds. And let's try this side. Okay, let it go. 35.
God.
So percentage-wise, that's greater than 50%. I don't have the math, but it was about 60-70% loss in your grip strength on your left side right now. So that can certainly be those are just a couple real cursory things that we could do.
Uh-huh.
If you don't mind, do you mind if I just kind of move your wrist here for a second?
Uh-huh. Hold on, I'm gonna give you guys a better view here. Hold on. Like this.
Yeah, so as you may or may not know, there's two different rows of bones in your wrist called the proximal and distal row. So we like to kind of just get a sense in neutral, first off, how it's moving, and also does that hurt you? Does that hurt me to move that part? And this is down below your fracture, so this is going to be into what's called the carpal bones.
That I feel.
So
Right where
feel
your thumb
there?
is? Yeah.
Feel a little. Is it hurt for me to move you, or just kind of where I'm touching?
Just where you're touching, and it's
Okay.
not overly.
But it is moving pretty well, okay? And then if we kind of go one notch up here, I just want to see, so again, open up this way as far as you can, let it go, and then just relax. And you did have a plate, you said, on that bone?
Yeah, yeah.
It's probably going to stay there. Do
Yeah.
you have any plans of taking that
No,
out?
they're going to leave it in
Yeah.
there. He said it's much better to just leave it there.
Yeah, how does that feel right there for you?
It's not
Does that hurt at all?
just a teeny bit,
Yeah,
right? When you
but there, how about that direction? Okay. So these are what we would call in our terminology, Rick, joint glides. So one of the things that we see a lot of times after immobilization, particularly post-fracture, is that you, because things are just sitting stationary for so long, is there's kind of an interface here between where your radius bone, which is the one you broke, and the underneath side bone here called the ulna. Those kind of articulate or move on one another. And any places, I tell my patients, any places where any two bones kind of move, you have a surface of cartilage called articular cartilage that allows that to glide nice and smooth. That cartilage will become a little bit, in essence, kind of dehydrated and a little bit stiff, just not as smooth and fluid, and you'll lose a little bit of just that natural lubrication. And so just as I'm mobilizing, we can kind of feel where that stiffness is in there, and also you have a little bit of stiffness I'm picking up in what we would call your proximal carpal row of bones. So that would lead to some of the loss of motion that you're having. Again, just in our complimentary injury screen for members, if I saw this would be something where you would be a perfect client actually for some regular physical therapy to work on some of these things that we're finding, because this isn't like a regular sprain that you might get in the gym and we give you a couple tips of advice to maybe then go try that. You really probably need a little bit more hands-on work, and every week in a good rehab program, every week you're doing a little bit more and more. We're tracking how's your range of motion going, how's your strength going. We'd be wanting to give you some, grip strength exercises. We'd want to be giving you, some different stretches. So it's just some couple recommendations for you right off the get-go that you might start trying, though. Okay.
Okay.
In absence of a formal rehab program, right? Because that might be in your best interest. That would be my recommendation for you is to get into a place like ours or another.
Is that occupational therapy or is it physical therapy?
Physical therapist. I work with wrist and hand and injuries all the time, but occupational therapists, particularly a certified hand therapist, that's kind of their specialty, is working with injuries into the hand.
I'm going to set this down because my arm.
Yeah.
I'm going to injure my other one. Here's what I'm going to do, you guys. So anyway, real fast. So this is Brad, Rick, and if you're in Elements Health Clubs, they will give you this free, what we just did, examination, so I know what to do rather than having to pay my doctor and go get the same information, and then I know where I can go. And also Elements then offers 10% off if you are joining the gym, and you've got the facility right next door where you got the pool and all the other stuff to go with it.
That's right.
I'm going to finish off on this so I can find out what I need to do. You guys share this on your page so other people understand. And Brad, thanks.
You're welcome.
Yeah. I want to find out what's going on with me, so hang on.